Dr. Chandika, can you get everything in, please?
Yeah, I'm ready.
Admit everything, please.
Sorry?
Admit everything, everyone.
Okay.
Oh, there's everybody.
Dear President, shall we start now?
Yes, sir, Dr. Sugata, please go ahead.
Yeah. Good evening, everyone. Good morning, Dr. Niemiec. You are welcome to Sri Lanka Veterinary Association third webinar series. This is our third webinar in third webinar series. Our resource person today is Dr. Niemiec, Diplomate of American and European Veterinary Dental College and Fellow in the Academy of Veterinary Dentistry. Our moderator is Dr. Chandika Wickramasinghe, well-reputed veterinarian in Sri Lanka. So I invite Dr. Nilan Satarasinghe, the President, Sri Lanka Veterinary Association, to welcome you all. Dear President.
Yeah, thank you very much, Dr. Sugat. And also good evening to all of the Sri Lanka Veterinary Association members. And good morning and good afternoon to all foreign veterinarians joined today's webinar. Sri Lanka Veterinary Association started this webinar series during the COVID pandemic to educate our members and also share the knowledge with foreign veterinarian. So it is actually nice to, and also a pleasure to say that we are continuing the same practice even though we are coming back to the normal day-to-day life. I think it is a very good platform to share our knowledge with experts, especially the international experts. And first, actually, I must thank Dr. Brook A accepting our invitation and allocating his valuable time to share his knowledge with our membership and also the audience who joined today. As Dr. Sugata explained, he's a well-renowned expert in veterinary dentistry. So I think it's a very good time for us and also valuable time to spend I think next 1 hour, and we can share his knowledge as well as we can ask any questions from him on the inquiry problems that you have on your day-to-day practice. So without taking much time, I am passing the floor to Dr. Chandika, today's moderator, and also is a leading companion practitioner in Sri Lanka, as well as one of our executive committee member in Sri Lanka Veterinary Association. Dr. Chandika, over to you. Dr. Chandika. Dr. Chandika. Dr. Sugat, can you hear me?
Yes, I can hear you. Dr. Chandika.
He's coming.
Thank you, Dr. Liana and Dr. Sugat. So, good morning, good afternoon, and good evening. Yeah, can you all hear me?
Yeah, we can hear you. Yes.
Dr. Chandika? You are muted, Dr. Chandika.
Dr. Sugat, can you hear me?
Yes, yes.
Now we can see you and also we can hear you.
Right, okay. Thank you, Dr. Dilan and Dr. Sugat. So, as usual, good morning, good afternoon, good evening to you. All joining from different parts of the world. And also a special good morning to Dr. Brook. So our lecture today is on periodontal. So the structured lecture followed by a Q&A session. And during the Q&A session, you can either unmute your microphones and ask questions directly from Dr. Niemiec, or else you can type your questions so that I can read out the questions to Dr. Niemiec. And also, please note that this goes live on YouTube channel. So if there is any limitation to the capacity of Zoom, you can see the lecture through the YouTube channel also. So actually, it's an honor to me to introduce Dr. Niemiec to you all, because I consider him as my mentor in veterinary dentistry. In fact, it was one of my dreams one day to have a lecture from him to our Sri Lankan fellow veterinarians. So I consider this as a dream come true. So Dr. Brook Niemiec is graduated from University of California, Davis in 1994 and is a board certified specialist in veterinary dentistry, both in American and European veterinary dental colleges. And he is a fellow of the Academy of Veterinary Dentistry also. He has authored several publications on veterinary dentistry. And we know him mainly through the WSAV, World Small Animal Veterinary Association, as the president of the Global Dental Committee. He has rendered enormous service during the past several years as the chair of the Global Veterinary Dental Committee. So, Dr. Niemiec, I warmly welcome and invite you for the lecture.
All right, thank you. All right, so let's get this up here. Get started here. All right, so the reason that I really like to give this particular lecture is because, let me get my little pointer up here. There we go. Okay, the main reason that I like, well, actually one little other piece of introduction is that I am a board certified specialist in America and in Europe. I lecture all over the world, blah, 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 blah. But one of the things that's really important for people to know is that I spent 5 years as a general practitioner working in pretty low income areas of Southern California. So I do know what it's like to have clients that don't want to spend a lot of money on their pets. So I can be very basic as well. So what I'm going to talk to you guys about today is periodontal disease. And the reason that I really like to give this lecture is because a lot, if not most of what you were taught about gum disease is wrong, unfortunately. And our treatments fail because the way that we're treating it is incorrect. So what I'm going to do today is going to give you the real cause of gum disease. Notice down here, it says not all plaque is equal. And then we're going to start talking about how we treat it. The reason that I know all of this stuff and the reason that I know that things that you guys are taught is wrong is this book right here. About 5-6 years ago, I put this book together for Wiley. And as a board certified dentist, the stuff that I learned reading it going, oh my God, that's not what I was taught. Oh my God, that's not what I was taught. Oh my God, that's not what I was taught. The stuff that you were taught, I learned was wrong based on this book. Oh, by the way, if you guys are interested, if you do social media, this is a QR code that takes you to my Instagram page where I post a lot of educational information on there. If you have your smartphone available, you want to go on there, it'll take you right to it, but it's Dr. Brook Niemiec if you search it. All right, these are normal gingival tissues. They're coral pink in color. There's no plaque, there's no calculus, there's no redness. This is what you want your animal's mouths to look like. This is what you want your mouse to look like. The problem is it took me 2 years to find this dog to put him in this lecture. Why? Because he doesn't exist in nature. He doesn't. And that's sad because we as a profession, even in America, have allowed a certain amount of disease to be considered normal, but it's not. We need to do a better job with prevention, as we'll talk about in a little bit. This is a normal dental radiograph. And I'm just showing you this so you can compare it to what's going to come later when we see the disease. But the bone should fill up the areas between the roots. They should come up right up to the neck of the tooth right there. So this is normal. Okay. So I probably don't have time to go through this whole story, but it's a great story. But this is Zabalba. Zabalba is a jaguar in Belize who had 4 broken canines. He was a jungle cat, and he was eating chickens and goats and pigs. He was what they call a problem jaguar. The local farmers would do what you guys would do if you had a problem. You know, I'm not sure what your big predators are in Sri Lanka, tiger or something like that. You would shoot him, right? But they're endangered. So they captured him, put him into a sanctuary in the middle of nowhere. And they put out a call to all the diplomats at that time and said, who is willing to come down to the middle of the jungle in Belize to do root canals on a jaguar? And I was the one that was brave or stupid enough to go down there and work on him. So I'll tell you the story as we go through this lecture. And so this is Belize. So Mexico ends right here. And then where you fly into is Belize City. And we're way out in the middle. San Ignacio is the closest city. And we're about right there in the middle of nowhere in the forest. All right. So what causes gum disease? We have to understand our enemy before we can defeat them. What causes gum disease? Plaque. Plaque is the etiologic agent. If you have no plaque, you have no disease. We're going to talk about the genetic basis of gum disease, but the cause is plaque. Okay. What is plaque? Plaque's a biofilm. What's a biofilm? A biofilm is a layer of bacteria on a surface, and it can be anywhere. Biofilms are ubiquitous. There's a biofilm on the cup you're drinking out of. There's a biofilm on your keyboard. There's biofilms everywhere. They're not necessarily bad, but when they're allowed to build up, they become pathogenic. And the teeth are where they are allowed to build up in the mouth. It's a matrix of glycoproteins and polysaccharides. But the big thing is there's 300 million bacteria per gram. 300 million bacteria per gram. If you scraped your teeth this morning and got that white creamy stuff on your fingers, or if you flossed your teeth and got that cream cheese stuff on yogurty type stuff on your floss, it's all bacteria. That's all it is. They ultracentrifuge plaque to try and get more bacteria into it. They couldn't. Eventually, it gets calcified by the minerals in saliva to become calculus or tartar. Okay, that's the brown stuff we see on our teeth. That's what everyone associates with gum disease. That's not the case. But here's the most important thing. Plaque forms in 24 hours. So next week, if you guys go in and you clean and you have the most beautiful teeth, but the client's not doing any home care, that pet is infected the next day. And then in 3 days, tartar's forming. And in just 2 weeks, gingivitis is starting again. Home care on the human side has been proven to be more important than professional care done every 6 months. So this is all the stuff I had to take down to work on Zabalba. Bottom line is, I'm going to make this quick. They had no equipment down there. There was no hospital, even human hospital within an hour. So we couldn't take him anywhere else. And when I was trying to get all my stuff to go down there, my x-rays, my drill system, all that stuff, they told me they didn't have any electricity. So I had to bring, everything had to be hand operated, or battery operated. We could get oxygen, little e-tanks of oxygen, small little tanks of oxygen. They could get those from 3 hours away. So I did borrow sevoflurane gas anesthesia. And then the technician who worked for the company actually wanted to come with me, which was great because I needed a nurse to come down there and work with me as well. So I'll show you how we get this pet under anesthesia. All right, critical point. Wake up, everyone. This is critical. Supragingival plaque is the initial plaque formed. Okay. This is what you can see on the surface of the tooth. Once it gets turns into calculus, it can get really nasty, really thick. But here's the critical point. Everything that you can see on the surface of the tooth does nothing to that patient. I don't put this slide in here to show you the pus, to show you the hair. Don't put this slide in here to show you that this is 10 trillion bacteria on this dog's teeth. What I do is I put this in here to tell you that everything that you can see does nothing. Not all plaque is bad. Supragingival plaque is non-pathogenic. When it gets up underneath the gum is when it changes from aerobic to anaerobic. That's the bacteria that creates the inflammation that causes gingivitis and then into periodontal disease. So why is this so important? Because until you're cleaning below the gum line, at and below the gum line, you're not doing anything medical. Now, again, smooths out the tooth, decreases the production, sure. But from a disease management standpoint, you have to clean underneath the gum. Speaking of which, we were all taught, flip the lip, look for tartar, flip the lip, look for tartar, flip the lip, look for tartar. Wrong. Tartar is ugly, but it's not the cause of disease. As a matter of fact, if you have subgingival tartar and you scrape the plaque off of the tartar, the gums will heal to the tartar or the calculus. Calculus is not the problem. So you see this dog here. He's got zero tartar, basically. A little bit here, a little bit here. Teeth are pretty darn clean. So if you were using the level of tartar to determine whether you needed to treat this, you'd be wrong, right? Because you would look at this and be like, oh, it doesn't need to be treated. But look at how much inflammation. This dog is reacting to just a little bit of tartar. But then we look at this cat. This got a huge chunk of tartar. He's got an iceberg running down his cheek. You physically could not put more tartar on this cat's tooth. He doesn't even have gingivitis. So yes, does this cat need a cleaning? Absolutely, but not near as bad as this dog does. So number one, rather than looking at tartar, look at level of inflammation to determine if you need cleaning. But number two, if you want to get to really where we need to be, you just need to clean the dog's teeth every year. At least every dog needs their teeth cleaned every year. Because when you go to the dentist every 6 months, I hope, at least before COVID we did, right? So you need to get these animals. I don't care what the mouth looks like. I really don't. I clean dogs' teeth every time because the exam, we find stuff all the time. So you get this question all the time. Well, I've had animals all my life and I've never had this dental problem. Why do we see it now? Well, it's always been there. We just haven't really looked for it is the problem. But why are we seeing it more? Well, our pets like us are living longer, right? I mean, back when I was going, and again, this might be different in America than in Sri Lanka, but when I was going to vet school in the late 80s, if we got a dog out till, 10, that was old, right? A 9-year-old cat was old. Nowadays, we're routinely doing anesthesias 18, 19, 20. My record for anesthesia is a 23-year-old cat. My anesthesiologist is 26-year-old cat. I do 20-year-old dogs at least once a month. I tell people all the time, you guys might not get this joke, but 20 is the new 10 because these animals are living forever, giving periodontal disease longer to affect them. Number two, and again, I'm not sure what the demographics are in Sri Lanka, but in America in 1980, we saw dogs, right? We saw Labradors and Shepherds and Pointers and Rottweilers and dogs. Now what do we treat? Yorkies and Poodles and Maltese, and we keep breeding them smaller and smaller and smaller. I treated a 0.7 kilogram teacup poodle, 0.7 kilograms. That's not a dog. It's a hamster. And the problem is we bred them down. And when we bred them down, we made them more prone to gum disease. I'm going to go into this. I'm not sure if this slide is in here. So if it's not, I'm going to tell you this now. Periodontal disease is a genetic disease. So the cause is plaque. So plaque, if you have no plaque, you have no disease, no matter how prone you are to it. But little dogs, for the most part, and greyhounds, Cavalier King Charles Spaniels, are genetically prone to gum disease. So when they get inflammation, they start receding their bone pretty quickly. Bigger dogs, Labrador, Shepherds, Rottweilers, tend to be resistant and they'll fight it off. So, but the key is if you have no plaque, you have no disease, but little dogs are much more prone to it, okay? Case in point, 12-year-old Labrador retrievers at 12,000 feet. This is my dog, Kaylee. She passed away at 16. This is Sage. We literally just got back yesterday. Not this picture. This is last year. This is a 12-year-old dog at 12,000 feet. They're backpacking at 12. They're going to 16, 17 as a big dog. These little dogs go to 20. We need to take care of their teeth. So what does periodontal disease do? The first thing is called gingivitis. Gingivitis is inflammation only to the gingiva. So we don't have any bone loss yet. We don't have any recession yet. But what do we see? Well, redness and swelling of the gums, plaque and calculus on the teeth, increased bleeding, we're going to come back to that, increased bleeding on probing or during brushing and eating, and bad breath. Let's take a look at that for a second. Redness, swelling, bleeding, maybe bad breath at this point. What's that a sign of? If we look at this redness, let's pretend this is on the skin, right? And it's red, it's inflamed, it smells. What is that? It's pyoderma, right? It's an infection. Gingivitis is an infection. The problem is the vast majority of the veterinarians and veterinary professionals worldwide, even in America, would look at this dog and go, meh, it's not so bad. You know, let's wait. Let's wait till a lump needs to be removed, or there's some other reason that we need to anesthetize this patient. No, this dog is sick today. This dog is dying from this today, literally. We'll get to that in a minute. So this is how we like to think about it. If this dog came in to see you, and he cut his paw pad, right, on a piece of glass, would you look at him and go, you know what, let's just wait. Let's suture that later, right? It's fine. You know, he's eating, he's living, he's limping a little bit, but he's fine, right? You wouldn't do that, right? You'd suture it, right? So you'd have to sedate him to suture it. You have to sedate him to clean this. And people are like, oh, anesthesia for dentistry. No, right? No, because it's a medical issue. So here's the thing. We cut our paw pad there. If you don't treat it, what's going to happen? It's going to get worse. If you don't treat this, what's going to happen? It's going to get worse. So now, because we don't treat this, we end up looking like this. Now we got gangrene here, and now we got to amputate these legs. Why? Because we didn't treat it there. If you don't treat this, you're going to have to extract the tooth. In my opinion, an extraction is an amputation. Some veterinarians call it euthanasia because you're killing the tooth. You are. Oh, Dr. Niemiec, how can you crazy dentists relate a tooth to an amputation? Easy. What's a dog's hands? What does a dog use for its hands? Its mouth, right? So if its mouth is its hands, what are his fingers? His teeth, specifically his canines. So when you extract a canine out of a dog, you amputated a finger, and he only gets 4. So we have to start thinking of these teeth and these infection from the mouth more importantly. I'll get to that in a minute. So here's another thing about gum disease that you were taught, which is wrong. The first sign of gingivitis is redness of the gums. No, it's not. The first sign of gingivitis is is bleeding upon probing or brushing. You guys ever flossed your teeth and spit blood into the sink? You have gingivitis. You do. Your gums might not be red, but you have gingivitis. Okay. So here's a dog. Here's an example. This dog came into me. He's like 3 or 4 years old, came in for his first cleaning. Look at that. Does this dog need a cleaning? No, you can see it on the inside there. Okay. But you can't see anything here. This looks fine until you touch it. As soon as you touch it, blood starts pouring out. Okay. This dog right here, this area right here has got horrific gingivitis. You never would have known it unless you put him under anesthesia. This dog's infected. He is, and he needs to be treated. Okay. So that's what I encountered when I came down to work on Zabalba. He was a zoo cat, or not a zoo cat. He was a wild cat 2 months ago. And he's mad about being in this cage, basically. And the reason they found out he had become a problem jaguar is because he broke his leg and it didn't heal correctly. So you can see his 4 broken canines here. I went down to fix them because he had broken them trying to break in to get chickens and goats and pigs because he couldn't catch his natural prey. So the problem was the zoo vet that was volunteering there was off on vacation. So I had to figure out how to get him under anesthesia. And I had never anesthetized a wild animal before. Periodontitis. If you don't treat the gingivitis, it's going to proceed into periodontitis. Periodontitis is inflammation to the deeper supporting structures of the teeth, the periodontal ligament and the bone. Now you're going to get increased erythema, increased bleeding, increased swelling, and now you're going to get bone loss. Okay. So it's either going to be via gingival recession or periodontal pocket formation. This is a critical point too. Gingivitis is reversible. Treat the plaque and calculus, it's going to go back to being normal. Periodontal disease is irreversible. Once the bone is gone, it's gone. It's never coming back, ever, 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 ever. Okay. Periodontal, tell these people this all the time. Tell your clients this. Periodontal disease is 100% preventable. Clean the teeth every year, at least, and small dogs more. Brush the teeth or do some kind of home care every day. There's no excuse for a dog ever losing their teeth. The only reason that a dog loses a tooth from gum disease or gets infected is laziness. Laziness and being cheap. That's honestly the only reason. We can prevent it 100%. We cannot reverse it. Now, can I do some really fancy fun surgeries? Absolutely. Can we do bone grafting? Absolutely. Is it going to happen in Sri Lanka in the next decade? Probably not. And that's fine because again, once the disease gets bad, get the tooth out, get him healthy. Okay. So now because we didn't treat the gingivitis, now we got a little bone loss there. We got a little recession here, but I mean, this is probably a 5 to 6 millimeter pocket, but we can go in here and clean this up. I mean, that's not a big deal, but the problem is this isn't where my patients come see me. I'm sure you guys see this all the time. This is where we finally get to treat this animal. Now we've got pus pouring out here. This animal's got all this bone loss. It's wiggly, it's infected. we need to take these teeth out. We lost the battle. We have to amputate, quote unquote, all these teeth. And your client's not going to be happy about paying for it or losing the teeth. But we have no option. We allowed it to get to this point, or they allowed it to get to this point, to be honest. Okay, so this is where it is. Now, the problem is most clients and a lot of veterinarians' perception of the worst thing that happens with gum disease is bad breath and tooth loss, right? Well, that's nowhere near the worst problem going on. We'll talk about that in a second. So this is where I worked on Xibalba. This is my high-end Mayo stand called a bench, and this is my drill. You'll see that in a little bit. There's the oxygen and the SIBO. All right. So there's regional consequences of gum disease, meaning local in the mouth, and systemic. Every veterinary dentist believes in the regional consequences, except for one. I'll get there in a minute. Not every veterinarian believes in the systemic consequences of gum disease. So I do. I'm a strong believer. I'll tell you why as we go through this. But these are where you need to talk to your clients about why you need to treat gum disease and why you need to be why it's so important to treat gum disease, and no one understands it, is because it's not just bad breath and tooth loss. It causes so many things. With the regional consequences, it's more with small breed dogs. Large breed dogs don't typically get the systemic consequences. I'll explain to you, or the local consequences. I'll explain to you why. Okay, so what are the local consequences? Oral nasal fistulas, class 2 perioendo abscesses or infection, eye problems, pathologic fractures of the mandible, increased risk of oral cancer. Not everyone believes that, and osteomyelitis. So this is an oral nasal fistula. Okay, the periodontal disease has eaten up the inside of the bone on the inside of the upper canine, and there's a communication between the oral and nasal cavities. Okay, and so bottom line is this dog has got significant infection going on in the nasal cavity, but the rest of the mouth looks normal. So this is what it looks like after a tooth has been extracted. If you guys are having problems closing extraction sites and having fistulas, really it comes down to something called fenestrating the periosteum. Hopefully at some point Sri Lanka can have a lab on doing these, because they are a little challenging, but it's a pretty simple little thing to fix that. Once it goes into the nose, the only therapy is to extract the affected tooth, create a flap, and close it. In America, at least, if we get it before it gets into the nasal cavity, we can do periodontal flap surgery and guide it and save these teeth. But again, if I had a 9mm pocket and I was in Sri Lanka right now, that tooth's coming out. Okay. Eye loss. Why? Well, see, these dogs have this swelling, this chronic infection. The maxillary P4 and molar apices are within millimeters of the globe. So here it is. Here's what I like to show you guys. This is not an abscess. This is vitreous humor. This is eye juice pouring out of this dog's face. Why? See the zygomatic arch here? Here's the first molar. Here's the palatine root of that first molar. Look at the abscess there. This dog's had a chronic eye infection. They put him on antibiotics. No one treated it. And then all of a sudden, what happened? It finally got bad enough. The eye popped, just like our little friend down here. This dog lost his eye because of gum disease. Periodontal disease is no laughing matter. It's serious, and especially in small breed brachycephalics, your pugs and your Frenchies, there's no bone between that upper first molar and the eyeball naturally. Okay, so class 2 perioendo lesion is where the infection comes down here, gets in through what used to be the blood supply at the apex of the tooth, kills the tooth just like a broken tooth. This is just like a broken tooth. A class 1 endoperio lesion is where the tooth breaks, the infection comes in through the oral cavity into the root canal, causes the infection down here. In a class 2, it's where the infection comes down and gets into what used to be the blood supply, kills the tooth, and comes up over there and causes infection on the other teeth. Okay, so this is a very common x-ray to see in a small breed dog, especially a Shih Tzu and a Lhasa. This is why you guys need to be really careful with your extractions, and I'll talk about this more in a little bit, of small breed dogs and why x-rays are so critical. So this is a preoperative radiograph, okay? So the infection came all the way down here, took away all this bone. This jaw is not broken yet. That's a fibrous union, but it's really weak, and the infection came up here, came over here, and caused all this bone loss here. Really, the only thing holding this jaw together up here is the tooth. So if you extract it, you're probably going to break the jaw. I mean, you have to extract it, but you have to tell the client that the jaw could easily break, because if you don't take the tooth out, it's going to break eventually anyway. What we did, and again, this is probably not happening in your guys' country, we took out the back half and did a root canal in the front half, and all that bone grew in. So maybe in 10 years, someone will learn how to do endo in Sri Lanka, and we can, you can start doing this. But at this situation, you have to take the tooth out, and it might break. And if it does, You can fix it, but it's got a poor prognosis. But again, you can't help but have challenges with that. So I did eventually get him under anesthesia, and here's 1, 2, 3, 4, 5 teeth with direct pulp exposure. So we're working in his cage, and it's really scary because these cats breathe at once a second. So it's really scary to do that. And we don't need guns, we don't need backup, we don't need drugs. And oh, by the way, they had no monitoring. We had no nothing. We're just doing this out in the middle of the jungle. No pre-op labs, nothing like that. Okay, so here's one of the biggest reasons that we need to take care of these small dogs' teeth. This is a pathologic fracture. So pathologic means that the jaw broke because the bone was weakened by some pathology. We see that with like osteomyelitis or osteosarcoma in long bones, but in the jaw, it's typically periodontal disease, and it's typically the lower first molar of small breed dogs. Why? Because number one, small dogs get gum disease, but then number two, I'm not sure if I still have this slide in here. Yeah, so this is why small dogs break their jaws and big dogs don't. This is a normal dental radiograph of a 40-kilogram Labrador. Look where that jaw ends. There's 2 to 3 centimeters of solid bone below the mandibular first molar in a large breed dog. But when we shrunk them down, because this is the more normal carnivore, but when we shrunk them down, we shrunk their jaws more than we shrunk their teeth. And now, so small breed dogs have proportionally larger teeth than their counterparts. So this dog normally has 1 millimeter of bone down there. So if you start talking about the periodontal disease on top of that, that is right here, 0.3 millimeters of bone. If you look at this dog's jaw wrong, it's going to break the jaw. So this is why we really need to take care of our small dog's teeth so it doesn't end up like this. And if you have a dog that has advanced gum disease and you need to take out the lower first molar of a dog that's small, and I'll get to that in a minute, then you need to warn the owner that a jaw fracture could happen. Same thing with lower canines. That's probably about a 0.5 millimeter of bone there. So what I tell clients all the time, our vets all the time, if you have to take out the lower first molar of a dog over, say, 10 kilos, don't worry about breaking the jaw. 10, 20 kilo dog, they have plenty of bone down here. If you have to take out the jaw, lower first molar of a dog under 10 kilos, be afraid. If you have to take out a lower first molar of a dog under 2 kilos or 3, be very afraid because there's nothing down there. Same thing with canines, especially in cats and dachshunds. I have no idea why, but dachshunds tend to like to break their jaws when the lower canines are extracted. So this is a pathologic fracture. This is what it looks like on x-ray. So you can see the periapical lucency there, this weak, and then it finally broke. The thing about pathologic fractures, this is why you guys need to be cognizant of pathologic fractures. They won't heal until that first molar is taken out or whatever tooth is causing the infection. This is the 7th plate put on by a board certified surgeon, the 4th KE apparatus put on by a surgeon. The reason they don't heal is because of the infected tooth root. So the tooth root has to come out before the jaw can heal. Once the tooth root comes out, you can plate it or put a splint or wire or something to fix it like you normally would a jaw fracture or a long bone or whatever. But the problem is if you don't take the tooth out, it'll never heal. So that's why I want you guys to be cognizant. Again, these are typically small breed dogs. Dogs under, say, 5 kilos will typically be the ones that have jaw fractures from pathologic fractures. And they tend to be older. They tend to have periodontal disease. And it tends to be a low trauma, like a dog fight or falling down the stairs. If that doesn't break normal jaws, even in small breed dogs. So if you have a dog that's in a dog fight or fall down the stairs or something minor, not hit by a car or a baseball bat or a cricket bat or whatever, if it's something like that, then it could be a normal fracture. But if it's a small breed dog with a questionable history of trauma and periodontal disease, think pathologic. Okay. So in humans, there is an increased risk of oral cancer with periodontal disease. Why? Chronic inflammation, just like chewing tobacco or anything like that will increase your chance of oral cancer. Smoking and lung cancer, chronic inflammation will increase the risk of cancer. That's what it looks like. And finally, osteomyelitis. Osteomyelitis is an area of dead infected bone. Periodontal disease is the most common cause of dead infected bone. You can see this is not tartar. This is the dead mandible. Why did this dog's whole hemimandible die? Gum disease. Okay. So that's my high-end dental tool. It's called a Dremel, and I did buy this at a hardware store before I went. And this is the assistant doing root canals on the dog. So those are a problem, but they're not the big problem with periodontal disease. The big problem is, I see a question, what age to start brushing teeth in a dog? What I would say is that you should start getting the animal ready to have their teeth brushed as soon as the puppy is gotten. So if you get a puppy that, a young dog that's under 6 months of age, just get your hands in the animal's mouth. After that, I usually recommend starting to brush about 6 months, but you can certainly get your hands and start training as soon as they get there. So systemic consequences, okay, numerous studies. Basically, when you get inflammation to the gums, that inflammation is allowing the bacteria, or the white blood cells and gamma globulins into the gingival sulcus to fight off the infection. That allows the bacteria into the bloodstream. Okay, so what can happen? Oh, well, let me go back to this. One really important point that nobody really pays attention to: the bacteremia that is induced by a cleaning or an extraction is the same level of bacteremia induced by eating dinner or brushing teeth. And the bacteremia is naturally dealt with by the body within 15 minutes of completing the procedure. What does that mean? We veterinary dentists don't use antibiotics, like ever. I know we were all taught to use antibiotics with dentistry. You worry about the endocarditis and all that stuff. All those studies have been disproven. Please stop using antibiotics for gum disease. Stop. Okay. So what is periodontal disease affected systems? Well, heart disease, endocarditis, we've all heard of, kidney disease, liver disease, a change in inflammatory markers, so increased inflammatory markers, and canine cognitive dysfunction. All of these things have studies in humans and dogs. And then in cats, also renal disease, okay, and increased and heart misfunction. These are all studies that, and again, is there a cause and effect? No, but there is a link. Thousands of studies, I think, on the human side by now, and probably a dozen or so on the human side or on the veterinary side. It does increase disease, okay? On the human side as well, arthritis, especially rheumatoid arthritis, diabetes mellitus, pulmonary disease, people with bad periodontal disease die earlier than people in good periodontal health. There's at least one study, I think 2 out of Scandinavia, that show that people with periodontal disease have a higher risk of early death than smokers. Periodontal disease kills. It does. And it has no clinical signs. So we've got to treat it. So here's why I really believe in the systemic effects of periodontal disease. Because if you have gum disease, you get worse heart, lung, liver, kidney disease. When you treat the gum disease, the heart, lung, liver, kidney, and cognitive dysfunction improves. So we need to treat this. Okay. So we ran out of oxygen. The cat woke up on us. We had to run out of the room. And so this is me going back in town. This is a picture almost 20 years ago of me going into the town that's nearest by and getting some more oxygen. So speaking of anesthesia, there is no such thing as a pet that's too old for anesthesia. I tell people all the time, age is not a disease. It's a natural consequence of not dying. If all of the parameters are normal, there's no increase in risk. And we do patients that are 20 all the time, but we do need to work them up. And I'm not sure where the state of the art is in Sri Lanka, but you really should be running some pre-op labs. We really like an ECG as well. But the more you work them up, I tell people all the time, knowledge is power. And anesthesia nowadays is so safe, even pets with moderate derangements. And what I tell people all the time, when an animal gets a little bit sick, don't stop treating the teeth. That way, when they get really sick, you don't have to treat the teeth. Okay. All this information is on our website. This is my website, vdspest.com. We have client educational videos on everything. All right. So that's gum disease. That's what causes it, what it does, the systemic and local diseases that happen. Now let's talk about treating gum disease. Someone asked about home care. Should be instituted young. Why? Plaque forms in 24 hours, calculus in 3 days, gingivitis starts in 2 weeks, and the pocket is the same depth at 6 weeks, okay? There's 2 major divisions, active, which is brushing and rinses, passive, which is nutrition and treats. They are both effective if properly formulated. Active home care is the gold standard, okay? There's probably never gonna be anything chew-based, water-based, whatever, that's gonna be better than brushing. Why? Because brushing really gets, remember, up under the gum. So it's just like brushing your own teeth, 45-degree angle, rotary motion, clean away on the palatal-lingual surfaces. Active home care is very effective, okay? But it's got to be consistent. They've got to start, as soon as they can, do it daily to every other day for the life of the pet. The problem is the client compliance is really hard to get, even in America. They just don't do it. So a lot of times passive home care is the best option for successful long-term periodontal therapy. The problem is that there are tons of products out there that claim efficiency, but avoid those with no science. If you don't look, if you've got a product out there, and again, there's hundreds of products. I cannot talk about all of them. And I'm sure a lot of them aren't even available in Sri Lanka or whatever country that you're in right now. So you have to look for some kind of science, ideally, or you can look for the Veterinary Oral Health Council seal of approval. If you have a modicum of, if you have one of these, you have an idea that it actually does work. So you want something that's big, so they have to chew through it. But the big thing is with dental diets, they don't necessarily clean down to the gum line. So even though they may decrease plaque and calculus, that doesn't mean that they're good for the oral health. Because remember, everything on the surface of the tooth is cosmetic. Until they're down and cleaning below, at and below the gum line, they're not doing anything. So this, I put dry erase marker on a skull. And you can see this is a dental diet. It has VOHC approval. And it does decrease plaque and calculus. But if we look at how it's working, it's shattering when we close the mouth. So we are decreasing plaque and calculus. Yes, does this have the 20% plaque and calculus reduction? Absolutely. But is it getting down to the gum line to clean the dog's teeth? No, it's not. So when you're looking for something, a product, whether it's a diet, a treat, whatever, it's got to be soft that the dog has to chew through. So this is TD. This is my favorite, plain and simple. I'm not paid to say this. I lecture for them because I believe in the product. I reviewed the research. This is why I like TD. Look at how it holds onto the tooth all the way down to the gum line. Look at how much was cleaned with one bite. So from that standpoint, this is why you need to look for products that will get down all the way to the gum line. And that really comes down to soft products. So I love TD. If you guys have greenies down there, I think it's fine. I do like rawhide chews. I like Veggie Dent, which is from Veerback. There's a lot of products out there, but just look for the research. So that's home care. So plaque control is a 4-pronged attack, depending on the level of disease. The first step is always a prophy. And if everything is normal on the prophy, just jump straight to home care. Periodontal surgery is where you have pockets, and extraction is the cure. So a prophy, good balanced anesthesia, supragingival scaling, subgingival scaling. This is the most important part right here. Subgingival scaling. If you're not cleaning below the gum line, you're not doing anything medical for this animal. Polishing the teeth, dental exam, and charting is the second most important step of a prophy, in my opinion. And then dental radiographs. I mean, ideally, I know it's not really common there, but they're critical. So cleaning the teeth, I'm doing pocketing. When you find pockets, and again, I'm telling you that 90% of the dogs that you do a dentistry on, at least 90% have gum disease. They have pockets. And if you don't look, you're never going to find them. So pockets between 3 and 6 millimeters are best treated with a combination of closed root planing and ultrasonic. So getting a curette. Curettes are inexpensive. Making sure you get these pockets clean. This is where the medical magic is happening, cleaning up underneath the gum. And then I do like perioceutics. I'm not sure if you guys have these, but Clinderol or Doxyrobe, they're just locally applied antibiotics. I think they're great. You should be charging for this. There should be an extra charge because a prophylaxis or a cleaning or a cohat or whatever is prevention of gum disease. Now, when you have 3, 4, 5, 6 millimeter pockets, you have active gum disease and you need to treat it. But here's the big thing. This is a critical point as well. Once you have a pocket that's over 6 millimeters or the furcation 2 and 3, and I'll show you pictures of that in a minute so you guys can understand. A human periodontal surgeon cannot clean a 7 or 8 millimeter pocket without creating a flap to do it, which you guys are not going to do. What does that mean? You need to pull the teeth. End of story. And yes, I know the tooth isn't loose. And yes, I know the client doesn't want to pay for it. And I know you don't want to do it. The problem is If you have an 8mm pocket or furcation 2 or 3, you can't effectively clean it and you're leaving infection behind. So unless someone's trained on doing periodontal flap surgery, you need to take the tooth out. It's the only option that you have. Because here's my example. Here's an 8mm pocket on the inside surface of an upper canine. My resident, okay, a dental resident, used an ultrasonic scaler and a curette to clean this. And he thought he got it clean. Really nice, down 6mm. The bottom of the pocket's not clean. You completely wasted this client's money, completely wasted this dog's time under anesthesia, left an infected tooth in there. Okay. And trust me, this is a resident doing this, not someone that's barely trained. So you got to take that tooth out. Same thing with furcation exposure. Furcation 2 is halfway through, like that probe goes halfway between the roots, and furcation 3 is through and through. There's only one option, and that's extraction. For now, maybe in 10 years, you can refer for perio surgery or whenever, hopefully somebody, trying to go will do something to learn how to do some of these advanced procedures. But for now, extraction is the cure. Okay. Speaking of extraction is the cure. I hate taking teeth out. I tell clients every day, I'm a dentist. I trained for 20 years on how to save teeth. I wrote the book on gum disease. I've done the research on it. It works. Periodontal surgery is great. But cleaning, home care, perio surgery, as soon as you stop, that infection's coming right back, just like that. So the cure is extraction. Once the tooth is gone, it's gone. I tell people all the time, the tooth is the root of all evil. When the tooth is gone, the animal gets better. End of story. So again, this is where you need to be really, really, really careful, with your extraction, because there's almost no bone down there at all. So I'm a big believer in minimally invasive surgery. I don't make flaps if I can avoid it. I do everything closed if I can. Pre-op radiographs are critical. Small, sharp instruments. I use luxating elevators as opposed to standard luxators. I'll use an envelope flap and then high-speed burst for sectioning. We do have online courses as well. That's on our website if you want to check it out. So I'll finish up Zabalba's story, and then I'll take any questions. So if you guys want to start putting questions in the chat while I tell the story. So basically, I told you that we got halfway through with Zabalba and he woke up. So we had to dart him down when we got back. And we were there for a week. We went on vacation. It was, Belize is probably a lot like Sri Lanka. I mean, there's lots of beautiful jungles, and there's waterfalls, and there's caves, and it was really cool. There's a lot of Mayan ruin sites and stuff like that. So we were on vacation for 5 days. And then we came back the last day that we were there to re-anesthetize him to finish up the root canals. And the problem was all the local farmers who worshiped this cat, like this cat, knew about him, all wanted to watch us. So we had 100 locals watching us do this cat. And it's always fun working with an audience when you don't have any monitoring, anything like that. So we darted him back down, and I went to work, and I finished up his root canal in about an hour and a half. I'm like, okay, let's wake him up. Let's go. And everyone's like, no, I want a picture with Zabalba. So they're going in there, putting their head in his mouth. They're taking paw prints. I'm like, dude, I want this cat awake. And so they push everyone out of my way. And poor Regan's over in the corner. That was the nurse. And she can't monitor him anymore. And so luckily they were all short. They're all 4'8" to 5 foot tall. And I'm 6 feet tall. And I was looking over them, and I could see he wasn't breathing. I'm like, Regan, is he breathing? And she's like, I don't know. So I pushed everyone out of the way. I grabbed her stethoscope. He was in arrest. He was dead. So I did a lot of cursing. I threw him on the ground, and I started doing CPR. And after a few minutes, we got him back. His heart was beating, but he wasn't breathing. And so I was rolling him over and pulling on his tail, and I poked his eye. I did all this and put a needle up his nose. I didn't know it was an acupuncture point. I just thought it would hurt really bad. It would stimulate him, but nothing was working. And after about 10 minutes, everyone was going, what are you going to do? What are you going to do? What are you going to do? I finally looked down, and I was like, he's a boy cat. So I reached down and grabbed his testicles, and I went, ugh, and he goes, ugh! And he woke up, and man, he was mad. And he was chasing us out of the room because all the drugs were gone. And I found out later, and I won't go into the long story of this, but testicular retraction is actually something, if you have an animal that's a male animal that's intact, that is not waking up from anesthesia or not breathing after anesthesia, if you pull in its testicles, it will actually make him breathe. They used to teach that, and I've talked to people that was something that they had later on. So that is my presentation. I'm not sure how you guys want to handle the question and answer period of picture of that. I think I have already answered the toothbrushing one. So however you guys want to handle the question and answer part. There we go. Do I recommend IV antibiotics? No, I never recommend antibiotics. I tell people that never is a strong word. Never. Antibiotics are essentially never. I never do pre-op, never. I mean, and again, honestly, I say never is a big word, unless the client absolutely forced me to, or a general practitioner sometimes will force me to. There is zero indication for preoperative antibiotics. Postoperative antibiotics, going home. That dog was more infected in the mouth, because again, remember, that dog entered into your practice with a horribly infected mouth. You removed all the infection from the mouth. That was your job, to remove all the infection. Even if you didn't remove all of it, you removed the vast majority of it. So the dog is less infected leaving your practice. The bacteremia was dealt with by the dog naturally before he left your practice. So what the hell are you treating when you send it home? Nothing. You're treating because of what we've always done. Now, intraoperatively, there is, in my opinion, there is one indication for intraoperative antibiotics, and that is subaortic stenosis, which is probably 1 in a million. So the answer is antibiotics, never. Not with heart murmurs, not with kidney disease, not with liver disease. I mean, maybe if a dog's on chemotherapy, maybe if a cat has FIV, maybe, but honestly, the answer is no. We as veterinary dentists don't use antibiotics. Anyway, best, and again, see, I'm getting all these antibiotic questions. Just stop asking me questions about antibiotics. And the answer is no. If I had to use it, if I was choosing a drug for an antibiotic for the oral cavity, it would be Clavamox, augmentin or Clavamox or clavulanic acid, amoxicillin. That would be my number 1 choice. My number 2 choice would be clindamycin. But honestly, I can't remember the last time I prescribed antibiotics. They're just not indicated at all. I know this is the big thing. This is why I like to lecture and tell the story, because everyone uses antibiotics for dentistry. Why? I'll tell you this really quick, because I don't see any other questions in here. So we might be the last one that we antibiotics that's what I asked about. The reason, I'll explain to you the reason that we all use it or used antibiotics. We were all taught to use antibiotics for dentistry. In the 70s and the early 80s, they did blood cultures on people and dogs that were getting dentistries. And what they found was if you had an infected mouth and you had a dentistry, you developed a bacteremia. And everyone freaked the heck out about the bacteremia being created by the cleanings. But what they didn't do is blood cultures of people and animals during normal daily activity. And in the 90s and early 2000s, they did those studies. Don't quote me on when those were done, but that's when they did that. When they did that, they found out, like I said, the bacteremia introduced by brushing your teeth is the same level of the bacteremia induced by a cleaning. So if you think that dog needs antibiotics to eat dinner, then you can go ahead and give them antibiotics for a dentistry. If you don't, stop giving antibiotics. I know it freaks you out. I know it's scary. Trust me, I do. It's what we've always done, and change is hard. I get it, but you got to. It's a complete waste of time, money, everything. You don't need antibiotics. Plain and simple. I can't, like I said, again, if you have infected bone, if you have true osteomyelitis, which again, you guys probably see once in your career, then using antibiotics is indicated. But the problem is the antibiotics aren't going to fix it because the bone is dead. So you can't get antibiotics into it anyway. So yeah, please stop using antibiotics. I can't say it. I can't say it enough. Any other questions before we say goodbye and you guys can go, I don't know, go to bed, I guess at this point, and I'm going to go start my work day.
Dr. Chandika. Dr. Chandika.
Yes, Dr. Sugat.
Yeah. Shall we start the Q&A session then?
Yeah, if you have any other questions, you can ask directly from Dr. Niemiec, or if you want, you can type as you have already done. I invite you all to get maximum use of the lecture. If you have any questions, directly ask from Dr. Niemiec. There's another text question, Dr. Niemiec. Says, I am from Bangladesh. How can we develop dental unit?
Are you talking about
any comment?
Are you talking about like an actual like the drill system or how you expand dentistry. So if you'll come back and that. So yes, the best pain medication for, come back and ask me, clarify the question. As far as best pain medication, yes, anti-inflammatories are the best. And yes, anti-inflammatories and analgesics is the best. In my opinion, if a dog can handle it medically, non-steroidals are the best. It doesn't matter which one you use. My personal one of choice is Metacam, but you know, Carprofen or Previcox, I mean, any NSAID's fine. Again, you should have pre-op blood work. You should have pre-op labs to show that the kidneys and liver are okay. But my drug of choice is going to be a non-steroidal. That's the best thing for all pain. We don't use a lot of tramadol anymore. It just doesn't work all that great. Gabapentin or buprenorphine would be our other thing. Prednisone is not really a very good pain management. It will decrease inflammation, but it's not as good of a pain management as a non-steroidal is. But yes, in some countries it is used because NSAIDs can be hard to get. I know that my resident in Brazil uses them, but it's very controversial and I would not recommend it. Total medicine protocol for gingivitis. I mean, really, it's just cleaning the teeth. I mean, bottom line is if you have gingivitis, if you scrape off all the plaque, you've cured it. So, you know, I would not use any medicine. You cannot medically treat periodontal disease. You have to, the key to treating periodontal disease is removing the plaque. It's mechanical removal, plain and simple, is the only way to treat periodontal disease, in my opinion. Well, in anybody's opinion, really, as a dentist. I'll go back and I'll just, in the last couple minutes that I have, as far as creating, you know, I'll take that if you're trying to create a dental, some kind of dentistry in Bangladesh, the best way is education. By far and away, the best way to get people to start doing dentistry and to do better dentistry, you got to start at the basics with this lecture, or getting somebody like Chandrika to come over and give the lecture that we did in India not too long ago, the Train the Trainers. Get people to understand what the dental disease is doing to their pet, whether it's periodontal disease or endodontic disease. Get the local veterinarians to understand the importance of treating periodontal disease. Get that information out to your clients, and then they're going to start asking for it. As far as getting, you know, more, then on top of that, once you have people saying, yes, I want to do that, then we need to get the training going in there. And next year, I'm not sure if it's easy or not for y'all, but Wasava next year is in China. So that might be a better place. I know they're working on doing a regional thing back in Southeast Asia as well. So getting some kind of training. And I know that we have a local person in Sri Lanka that is an enthusiast that can help you guys do it as well. Okay. I think that's our lecture.
Yeah, if you have no more questions, we can wind up the lecture. Do you have any final questions? We have a few minutes remaining if you want.
Okay.
So before Dr. Sugat does the official vote of thanks, I would like to thank again Dr. Niemiec for accepting our invitation and spending his valuable time and busy time with us. Thank you very much, Dr. Niemiec. And I invite Dr. Sugat to do the official vote of thanks.
Thank you very much, Dr. Chandrika. On behalf of Sri Lanka Veterinary Association, I would like to extend my sincere gratitude to our resource person, Dr. Niemiec. Thank you very much, sir, for your great support to success our webinar today. It's a very informative and very useful presentation to the veterinarian in the region. And also, I would like to thank our moderator today, Dr. Chandrika Wickramasinghe. Thank you, Dr. Chandrika, for your great support. And also our participants today from different countries in the region, as well as from Middle East too. Thank you very much for joining with us. And I hope you will join in the next webinar also. And finally, I would like to thank our Sri Lanka Veterinary Association team for supporting to success this webinar. Thank you.